Okay, good morning, guys. This is a great Wednesday morning, and now I'm presently at this UKM Specialist Center. Okay, I'm meeting Professor Dato, Dr. Ritza. That's my main doctor, who have helped me a lot since the very first day I know him, since 2018. Okay, I've been here that he helping me to diagnose and also refer me to this Dato doctor, this oncologist for this chemotherapy treatment, and also have operate me and remove all the cancerous tumors from me, and also finally have also referred me to the lung specialist if I have a lung defection. So I'm grateful here today to meet him to get the review on my health report after every 6 months after discharge from the hospital. I will come in to have a day care to inspect endoscopy and cancer marker and also CT scan. So okay, let me introduce Professor to you now.
Good morning, everyone. So I'm with Peter, or Mr. Lee, to be more formal. Okay. So Mr. Lee or Peter actually came to see me sometime late in 2018, presented with difficulty in swallowing, and endoscopy showed that there is a growth or a tumor in the lower part of the esophagus. So just like any suspicion of cancer, we always take a biopsy, and unfortunately that confirmed it was a cancer. It's an adenocarcinoma, one of the type of cancer. And when we have diagnosed, we need to make sure whether that this patient is suitable for this tumor to be resected. Hence we did a staging. And one of the important staging modality is a CT scan. So we did a CT scan on the thorax, abdomen and pelvis. Okay, and the good news was that it was a localized but advanced tumor. Now, because of the sheer size of the tumor, we referred him to our oncologist, Dr. Fuad, and he underwent a neoadjuvant or preoperative chemotherapy. The aim is to downsize the tumor, hence making my operation later on easier, but also to wash out any tumor or micro tumor which is disseminated elsewhere. Okay, so once he completed the chemotherapy, he underwent surgery to remove the tumor. Okay, and I was very pleased that following surgery he progressed very well, and now it's coming up to well, it's more than a year, right? And just like any patient who suffer from cancer and who had surgery, we aggressively follow them up at least the first 2 years. And about 2 weeks ago, he underwent surveillance test to ensure that the tumor is not there or hasn't come back, okay, and hasn't spread anywhere else. And the good news is Peter's CT scan showed no evidence of cancer anymore. Number 2 is his blood tests are all perfect, okay, in fact better than mine, including tumor markers. And lastly, what else did we do? Endoscopy. Also, endoscopy was absolutely fine and there was no sign of tumor recurrence. So I am absolutely thrilled and happy with Peter's progress, okay, and I hope the best will come more for Peter. And obviously, I remember when I first saw Peter, he was completely a different person. He was very thin. Somebody with cancer, they don't eat that much. They look very weak. But this is a complete different Peter now. So I'm very pleased that at 1 year post-op, he is free from cancer. And I wish him the best of luck in the future. However, a rigorous and rigid follow-up still needs to be done. Okay?
So I'm grateful and thankfulness. Actually, God has arranged me to meet up with Professor. That he is indeed very caring, and his knowledge has saved my life. Okay, and also since 2018 until present, he have made my direction clearer, stay more healthy, and leads me to prolong my life. So I'd like to thank you, Professor again, for his help, and always remember his advice. And for you guys there, if you haven't subscribed my channel, please subscribe now, and don't forget to press the bell, and please share it out to all and everybody in the world, especially those who need cancer survivor and those who diagnosed with cancer. Thank you guys, and see you in my next video again.
See you, bye!